this month, and it comes as studies showed that mammogram rates have dropped as much as 40% during the pandemic.
Yeah, for a lot of reasons, and the fear of COVID overshadowed fears of cancer for some. That has led to an urgent message from the American Cancer Society to get screened. KTVU's Heather Holmes has more on the importance of these screenings.
March 2020, the world shuts down. Countries seal borders, sports teams cancel seasons, schools close, and employees go home. COVID-19 was everywhere. Responding to the pandemic was the priority, and cancer care took a back seat.
There has been patients who are delaying their screening mammogram.
Dr. Irene Lo is a breast cancer surgeon. At the height of the pandemic, testing for various forms of cancer, including breast, dropped dramatically. Dr. Lee says they are seeing the impact of those skipped appointments.
We've seen that patients have cancer diagnoses that are diagnosed at a later stage.
When you say later diagnosis, how much later?
Potentially to the point where the cancer has spread to the lymph node underneath the armpit, and so that's stage 3.
Preventative cancer screenings have since returned to pre-COVID-19 levels, but there are concerns about those who have fallen through the cracks.
We're still struggling to catch up, struggling to get imaging done. People are still scared.
General Surgeon Dr. Irene Lo is hoping to ease any fear or anxiety about the screening process by allowing us to document her first mammogram at John Muir Health in Walnut Creek.
Oh, I'm nervous.
Dr. Lo recently turned 40, when most women should start receiving mammograms. We met her at the Breast Health Center where COVID-19 protocols are in place.
This isn't something I normally would want to share publicly, but I think this is such an important issue.
We'll take this exam room in here.
Once in the exam room, Dr. Lo wasn't sure what to expect. Would it hurt? How long does it take?
What we do here is take a series of x-ray images.
The technician walked her through each step and when pressure would be applied. Several images were taken from different positions to get a clear picture of the breast tissue. The whole process from check-in to completion took less than 30 minutes.
I was explained every detail. It was a tad uncomfortable to have the compression and everything, but went very well. Huge sigh of relief for that to be done, and I look forward to my results.
The mammogram images are then reviewed by a radiologist who looks for anything unusual.
We look through them using this new 3D technology where you're able to actually scroll through the breast slice by slice.
Dr. Eric Chen specializes in breast imaging at John Muir Health.
Things that we're looking for include calcifications of the breast. Most calcifications are benign in the breast, but early breast cancer can present as calcifications. And we're also looking for masses or distortions of the breast.
When possible, he also will compare the mammogram to previous ones. This can help show if any findings are new.
We certainly want to find them as early as possible.
Dr. Lo was called back for additional imaging, and thankfully the results were negative. She told me if her experience inspires one woman to be screened, her efforts would be worth it.
Breast cancer screening needs to happen. We need to be able to kick cancer's butt, and we need to do that through screening.
In Walnut Creek, Heather Holmes, KTVU Fox 2 News.